Hey everyone, and welcome to The Explainer. I am absolutely thrilled you're tuning in today because, let's face it, we are tackling a topic that is just surrounded by so much noise and confusion, and that is weight loss. But listen, you can go ahead and forget all those internet fads, the crazy crash diets, and the gimmicks. Today, we're breaking down a highly structured, purely medically sound framework for sustainable weight loss. We're talking about real, evidence-based science here. But hey, before we really get going on this journey, please take just a quick second right now to hit that like button and subscribe to the channel. It really helps us out, and it makes sure you never miss any of our deep dives into the science of your health.
Okay, let's dive into this. We are looking at a holistic challenge built on 5 distinct pillars today: mindset, exercise, diet, medicine, and finally, sleep.
So let's kick things off with pillar number 1, the anti-gimmick mindset. Because honestly, before we can even begin to change your biology, we absolutely have to change your psychology. Now, you might be wondering what that actually means in practice. Well, the reality is that this takes planning and discipline for months, not days. The medical science is incredibly clear on this point. You literally have to actively convince yourself that this goal matters enough to sustain a long-term effort. If you're coming into this with a quick fix mentality, just hoping to drop 10 pounds by next weekend for a party, you're pretty much already setting yourself up for failure. You are building an entirely new lifestyle here. You aren't just renting one for a few weeks. Right. So once the mind is primed, we need to activate the body, which brings us to pillar 2, moving with purpose. For this to work, your exercise routine needs 2 distinct engines firing at the same time. First up is aerobic exercise. Think walking, running, swimming, that sort of thing. The medical guidance tells us to aim for about 45 minutes a day. Second is resistance training. Using weights or resistance bands is absolutely crucial because it builds muscle and actively supports fat loss. But hey, outside of the gym, do not underestimate the power of your daily habits. Just getting up for a quick 5-minute walk every hour, choosing the stairs over the elevator, or going for a short stroll right after a meal. That cumulative effect is massive. Those tiny little behaviors keep your metabolism engaged all day long. Now, what's really interesting about this is the actual math behind your aerobic effort. You've probably seen this formula floating around before, 220 minus your age. But notice how we are multiplying that number by 70 to 85%. That right there is your target zone for those daily 45-minute sessions. See, the full value of 220 minus your age, that's actually closer to the absolute maximum safe limit for your heart. It's definitely not the target itself. You want to live in that 70 to 85% sweet spot to safely and effectively burn fat. And that naturally leads us to pillar 3, the diet mathematics. Now, while exercise is fantastic for your heart and muscles, the hard medical truth is that exercise alone rarely moves the needle on weight loss without strict diet control. Oh, and a quick side note before we even talk about food. Limiting your alcohol intake is highly, highly advised. Alcohol is incredibly calorie dense, and honestly, it's one of the biggest hidden traps for weight gain. Seriously, if you only take one single concept away from this entire explainer, make it this one. A full 1-hour brisk walk burns roughly 300 calories. Eating just one single samosa, that also contains about 300 calories. They are mathematically identical. Think about that for a second. It takes 60 grueling minutes of hard physical effort to undo just 3 minutes of enjoying a fried snack. Keeping that stark reality check in the back of your mind is arguably the most powerful tool you have for portion awareness. You just can't out-exercise a bad diet. So how do we practically fix things? It's pretty straightforward. Out with the bad, in with the good. We need to aggressively cut out simple carbs and dense calories. We're talking sugary drinks, processed sugar, jaggery, white bread, biscuits, and refined flour. We also need to completely ditch trans fats, excess saturated fats, and fried foods. But the good news? You get to replace them with amazing stuff. Swap out the fruit juice for whole fiber-rich fruits. Go for whole wheat flour. Load your plate up with green veggies, and trade those bad fats for healthy, unsaturated fats, which you can easily get from nuts, olive oil, and fish. So, the crucial point in all of this is making sure you are getting enough protein while making those changes. The clinical guideline is to hit about 1 gram of protein per kilogram of your body weight every single day. Why is that such a big deal? Because protein drastically improves your satiety. It essentially tricks your body into feeling full, which directly stops you from overeating. And by the way, if you want a much deeper dive into how to effectively hit those protein targets, make sure to check out our dedicated explainer on protein intake right here on the channel after this video. All right, Shifting gears now to Pillar 4, modern medical interventions. We are stepping away from lifestyle changes and looking at external biological assistance, specifically focusing on purely evidence-based medicines. And this brilliantly illustrates just how far the clinical advancements have come. Semaglutide has been shown to produce an average weight loss of around 15% of a patient's total body weight, and tirzepatide pushes that boundary even further, hitting around the 20 to 22% mark. Now, obviously, individual results are always going to vary, but these are profound, scientifically validated numbers that really ground these treatments in medical reality. But, and guys, this is a massive, massive but. These medications are not just magic shots that you take in isolation. Medical supervision is 100% mandatory. You need a doctor to monitor you and discuss side effects and contraindications. Furthermore, eating adequate protein and keeping up with regular resistance training is absolutely non-negotiable while on these drugs. If you just take the medication but fail to eat your protein or lift weights, you are going to lose valuable muscle mass right along with the fat, which totally defeats the purpose of trying to get healthier in the first place. Finally, we have arrived at our fifth and final pillar, the sleep foundation. This is essentially your body's internal biological reset. You should be aiming for 7 to 8 hours of real, quality sleep every night. And the science behind why is just fascinating. Poor sleep literally disrupts your hunger hormones. It is biologically sabotaging your diet from the inside out. When you're sleep deprived, your body actively ramps up its cravings for high-calorie, sugary junk food just to find some quick energy. To fight back against this, incorporating stretch exercises or yoga into your evening routine is highly recommended. And definitely check out our specific explainer on optimizing sleep on this channel for a complete masterclass on getting better rest. So I want to leave you with this final, somewhat provocative question. You could have the perfect mindset. You could be avoiding all the samosas, and you might even be working with a doctor on medical interventions or exploring advanced options like bariatric surgery for severe cases. But are your poor sleep habits silently sabotaging all of that hard-earned daytime discipline? Sustainable weight loss is like a giant puzzle. It requires every single one of these pillars standing strong together. If you found this explainer valuable today, please hit that like button, subscribe to the channel, and keep your learning journey going by checking out our other videos. Stay focused, stay healthy, and I will see you in the next one.